Welcome to this episode. Today, we're diving into some fascinating research around psilocybin and neuroplasticity. It's a topic that's been gaining a lot of attention lately, but there's a lot to unpack beyond the headlines.
Yeah, absolutely. Psilocybin, which is the active compound in certain psychedelic mushrooms, has really moved from the fringes into serious scientific study. Universities, clinics, and biotech companies are all exploring how it might affect the brain's ability to change and adapt, what scientists call neuroplasticity.
Right, and that's a key point. Neuroplasticity is this idea that the brain isn't fixed. It can reorganize itself, build new connections, and adjust based on experience. But it's not as simple as more plasticity equals better brain. Sometimes the brain can strengthen harmful patterns, like those linked to fear or addiction.
Exactly. I like to think of the brain like a network of roads. Neuroplasticity is like the ability to build new roads, close down old ones, or change traffic flow. But not all new roads lead to good places. Sometimes the brain might reinforce routes that keep us stuck in negative cycles.
That's a great analogy. So when people talk about increased neuroplasticity, it's important to ask, what kind of plasticity? Under what conditions? And what outcomes are we actually seeing?
And that's where psilocybin research gets really interesting. Researchers are asking if this compound can help the adult brain become more flexible in ways that support recovery from things like depression, trauma, addiction, or even distress at the end of life.
But there's still a lot we don't know. For example, what exactly happens in the brain after taking psilocybin? How does it change brain network activity, cognition, or emotional processing? And what about safety? Who might benefit, and who could be at risk?
Plus, it's not just about the psychedelic experience itself. The context matters a lot. Psilocybin isn't like a daily pill you take on your own. Most studies involve careful preparation, monitored administration, psychological support, and integration afterward.
Yeah, the setting is crucial. The environment and support system can shape how the brain responds. Especially in addiction recovery, it's not just about activating a receptor in the brain. Recovery involves learning new behaviors, managing stress, reducing inflammation, and stabilizing emotions.
That's why researchers talk about recovery biology as a bigger picture. It's not just one pathway or one compound. It's about how biology, environment, support, and timing all interact to help the brain heal.
Speaking of recovery biology, the Biotech International Institute has this concept called neuro reset. It's important to say up front that neuro reset isn't an approved therapy or treatment. It's an early-stage research idea focused on multi-target neuroplasticity and recovery biology.
Right, and before making any broad claims or moving to clinical trials, BII wants to clearly define and validate what neuroreset really means biologically. They're also looking at related areas like neuroinflammation with neurophorol and neurotrophic signaling with mycophorol.
So they're taking a multi-pronged approach, recognizing that brain recovery is complex and probably involves many pathways working together, not just one magic bullet.
That makes a lot of sense. And for any claims about neuroplasticity to be credible, they need to be measured objectively. That means brain imaging, cognitive tests, markers of inflammation, sleep quality, stress levels, and long-term behavioral outcomes.
Without that kind of measurement, neuroplasticity risks becoming just a buzzword or a hopeful story. BII really emphasizes validation, turning hypotheses into testable questions and measurable results.
And as psychedelics become more popular, the language we use to talk about them matters more than ever. Terms like rewiring the brain or resetting the mind can be misleading if they're not backed by solid evidence.
Absolutely. BII aims to participate in the conversation with respect for the scientific process, avoiding hype or premature claims. And this field really needs collaboration. Neuroscientists, clinicians, regulators, patient groups, all working together.
That teamwork is essential to develop safe, effective, and validated treatments in the future. It's not something any one group can do alone.
So to wrap up, psilocybin research has opened an exciting conversation about brain flexibility, therapy, and recovery. But the challenge is to keep that conversation grounded in careful science.
Neuroplasticity is potentially important, but it has to be studied in context, measured rigorously, and discussed cautiously. The future of brain recovery research depends on balancing public interest with disciplined validation.
For now, the story of psilocybin and neuroplasticity is one of promise, complexity, and the need for patience.
Yeah, it's a fascinating area to watch, but one where careful science has to lead the way.
Thanks for joining us today. We hope this gave you a clear picture of where psilocybin research stands and why neuroplasticity is such a key part of the conversation.
Take care, and we'll catch you next time.